one of the things, and this might be a question for Michael Donnelly from Telstra. I guess, Michael, when you hear those kind of problems, are they some of the challenges that your customers have seen across the years, and how do you kind of think about them and the catalyst for thinking about things and the partnership with Hayylo?
Yeah, sure, Greg. Well, first of all, I'd agree with Michael's assessment of software in the industry, and that is that for a long time, things were done the same way, and features were built on top of older and older software to the point when consumer-directed care kicked in over the last few years. Most of the Australian-based products in the market were 20-year-old plus, and so as a result of that, they have built up, all of them, really significant and important functionality, and they have people using them who are used to every part of that. And so, we certainly acknowledged when we acquired some of these businesses from Telstra Health that whilst they've done an absolutely fantastic job and they had, and still do have, wonderful teams, as we look forward, the world has changed and will continue to. And so sitting alongside the three products that we're continuing to maintain and support and develop is a new cloud-based modular interoperable platform that is not quite there yet for many of our clients, but we look forward to the day that it is. And in the meantime, our approach is to say, from a client-first landscape, how can we add value straight away? Now, certainly at the moment, with the way the world is and the changes to compliance, we're beavering away in all our teams to make sure that we are compliant in every part of the software, but we're also looking at the value adds. And to do that, as always, we talk to clients, and the Hayylo name kept coming up. And as a result of that, we've been talking to you guys for some time and realised that there is a really significant value add that we can deliver longer term, but also with current products we've got shorter term. And so that is really the lens. We'll build out the best sort of workforce management, rostering, scheduling, compliance reporting, insightful type product we can. And we'll look to organisations like Hayylo if we think there is a value add offering for our clients and that the organisation is really committed to the Australian market. We see that both with you guys.
Yeah, that's great. Greg, did you have any comment on that? I did want to step back on one thing quickly before we talk a little bit more about the partnership.
Please do.
I was going to ask, and you may have covered this a little bit before, so I apologise for stepping back on this one. But Michael Wickham, what I've been interested about in our time in the sector is, and even more so now, and is just how busy providers are generally. The day-to-day, things are moving, things are changing, government legislation's changing constantly. We talk about it all the time, the kind of reactive nature of the sector. And I was wondering, with all those moving pieces, and as Michael Donnelly was talking about, the compliance and these kind of core infrastructures, the core operating kind of elements of technology across the sector, what drove you as an organisation to start to prioritise that a little bit further? Was there something specific?
Yeah, well, I guess for us, it's knowing that communication is key. And in terms of compliance, a lot of it really comes back to how we communicate with clients and their loved ones. And to be able to do that effectively, but also free up more of our time to actually provide care, which is what we're here for. But looking at solutions too, and now that anything that we actually look at has to work with everything we've got, and that's not easy. And I guess that's one of the reasons we looked at Hayylo, is because it could work with the current systems we had. And when we look at rolling this out through residential later on, is having that ability to link it to our software that our staff in our residential homes are using to provide progress notes and things like that. Rather than double handling information, there has to be efficiencies with it, because our staff have more than enough to do already without putting something else onto them. So it's looking at those things that are going to work for the business and for the resident.